What do some of the surgeries entail? You mentioned one more surface level one. What's happening when a patient receives surgery for this?
So there are different types of surgical modalities. Deroofing surgery, that's where you remove the top layer of these tunnels and remove the what we call gelatinous inflammatory tissue and allow for the wound to heal on its own. So we're leaving the wound open. We're not closing or suturing because we know that sometimes closing the wound actually increases the risk of recurrence in that area. Then you have wide excision, which is typically done by general plastic surgeons and some dermatologists too, where we're literally taking out the entire area that is involved and going deeper also with the surgery. And the wound healing, obviously, for that type of surgery takes much longer. So if we can avoid doing that type of surgery by doing deroofing surgeries early, that's best. But sometimes patients have more extensive disease.
Mm. What are some misconceptions that patients often have with disease manifestation or treatment that you find yourself addressing most often?
I would say a lot of it has to do with diet. We know that diet plays a big role in HS pathogenesis and with the risk factors. So, talking about obesity, elevated BMI, metabolic disease such as diabetes, insulin resistance. We know that diet plays a role in all of those, and those are risk factors for HS. But I think a lot of patients don't understand is that diet alone is not going to fix or treat HS. It helps, but usually this needs to be done in conjunction with treatment. So I have a lot of patients who believe that if they just change their diet and eat healthy, their HS will go away. But this is a misconception.
Does Do procedures such as, let's say, like laser hair removal or any of those other kind of, what some might consider cosmetic dermatologic procedures, do those play a role in kind of impacting the disease at all?
It's really unfortunate that laser hair removal is considered cosmetic treatment because for HS, it is not, and for a lot of diseases, it is not a cosmetic treatment. We know that hidradenitis suppurativa starts in the hair follicles. So, if we can decrease the amount of hair follicles that are present by removing them through laser hair removal, then we can decrease the risk of progression of the disease. We're trying our best the HS experts in our community, we're trying our best to put the awareness out there so that insurance companies can understand that this laser hair removal treatment is not cosmetic, but it's an uphill battle.